basically offering the same training that I give to my own people when I'm training somebody from scratch in my practice, the same level of training that I give to my own people, basically offering it to to people outside of our practice. And it's absolutely wonderful. It's a great tool. Everyone who's ever taken our class is like, that was the most amazing thing, because it's offering instruction of a level which is a little bit higher than most people can access. And so we're very proud of that. And then
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Flora Waples, who holds degrees in chemistry and biochemistry from the University of Chicago and attended medical school at Weill Cornell Medical College in New York. After completing her residency at the University of Chicago hospitals, where she lived around the block from Barack Obama, she spent 15 years practicing emergency medicine and trauma care before transitioning into aesthetics and wellness medicine. She and her sister Dominique founded Restore Medical Spa in 2011 and have since grown their practice to 3 locations. Today, she practices cutting-edge aesthetic medicine and hormone replacement and optimization at Restore Medical Spa and also teaches at the Restore Academy. So Dr. Waples, welcome. Glad to have you here.
thank you so much for having me.
So let's dive into it. How did you first get interested in aesthetics?
Oh, well, the short story I tell people is I turned 35, I got a wrinkle, and that, and the rest is history. But there's actually a deeper reason that I tell when I'm not trying to just be trite, which is in so much medicine, almost every branch of medicine, we are fighting a losing battle all the time. It's reactive all the time, right? Something horrible happens to a person and you try to fix it. And then something happens and you try to fix it. And you keep losing ground. You and your patient both are always losing ground. And as I got further along in my career, I really wanted to have a win for myself and for my patients. I wanted to have, and that's really only possible in aesthetics and regenerative medicine. My patients come in, I see them, I treat them, and they leave better than they were before. And that happens each time they come in, win together. And so that's the true reason. Also, yeah, my own wrinkles were really very important to me too.
Got it. And I'm sure it must also be very different having to be in the emergency medicine, the trauma center, and doing that for so long, and then transitioning over to the aesthetic and wellness side, where it's a lot, I guess I'll call it happier.
Yeah. Well, it's wonderful because in aesthetics and sort of wellness medicine, like I can do what I do. If someone comes in, look, or I want, this result, I can say to that patient, I either do it or I don't do it. Whereas in the hospital, you kind of, whatever comes in the door, you just have to kind of roll with it. But it is, well, is it better to be in aesthetics because it's not as stressful, And the answer to that is no. I actually find it more stressful than emergency medicine and they've been run over by a bus or whatever horrible thing has happened. And if you're fast and if you're lucky, you may be able to save them. But if they die on the table, it's the bus. It wasn't you, Yeah. But in aesthetics, when someone comes into you, they are healthy. They're generally speaking, they're well, they're beautiful already. And so if you mistake in aesthetics, it's that bar, do no harm, set a lot higher. And so I take the medicine I do now. In some ways, it's more stressful because my patients are already perfect and beautiful. But I have to make them better than that. And it's a challenge. It's a challenging field.
Wow, that's interesting. I never really thought about it that way, but it's true.
Yeah.
It is very, very true. So then could you discuss some of the most popular treatments that your patients come to you for? And also, why do you think that they're so popular?
I think that patients, and I say that with love for my patient population, because I do love my patient population. They're me. They're ladies in their 40s, with kids and careers. They're exactly like me. I love them all. They tend to come to us asking for the wrong thing. That is something I think is very, very, very frequent because they are responding to things that they see in magazines and social media that their friends are talking about. And usually that's about 10 years behind what we're actually capable of doing, right? The cutting edge is not what's in sort of talked about in popular media. So patients come to me and they want, they'll ask for Botox, I'm like, well, Botox was a wonderful molecule, but there's all these other great molecules now, or I want filler here. And I'll say, this is a symptom. We got to put it up here instead. So I find that what patients come asking for, generally speaking, is they want fills, they want tox, and they don't know that they need filler. And my job as a professional is to sit them down and say, here's what's happening to you. And here's the plan that you actually need. Hopefully, if they trust me, then we can work together and go through that plan. But yeah, what they ask for, what they get, not a lot of not a lot of crossover sometimes.
Yeah, okay, I completely understand that part of it. Now, when it comes to, you mentioned that there's better options for them, or there's options that maybe they're not aware of. So are there any new or emerging treatments out there that you're particularly excited about that are on the horizon or are already here?
Yeah, oh, absolutely. No, I get easily excited by everything. So I'm always excited about something. But one thing I will tell you what I'm most excited about. But first I'll tell you a little story about why I find it so exciting. So the aging process, we have learned so much. We've learned so much about it in the last sort of 20 years. We used to think that the reason why we get hollows and folds in our lower face was because the skin was lax. And so the surgeons would take the skin, they yank it back, they staple it to the head, facelift, right? But it didn't look normal. They looked gaunt and witchy, and it wasn't a normal result because the real problem, the real reason why we get hollows and folds in our lower face is low structural volume, right? And we figured that out about 20 years ago, and we started using dermal fillers. And dermal fillers are they're wonderful molecules. I use them. Everyone uses them. I have them in my face right now. But there have always problems with dermal, which is they're very, very expensive. Patients, the number of syringes that they actually need. We have conversations every day where I'm like, you need 5 syringes. And the patient said, well, I can afford a half of a syringe. I'm like, well, okay, you do the best you can. But most patients can't afford the amount of volume they truly need. 2, molecules are not bioidentical. They're not native to our bodies. And because of that, people will periodically get allergic reactions or immune reactions. We have nodules that form. There's all these issues that can form with it. And they don't always stay where they're put. And so they're the best thing that we have. They're wonderful. They're much better than what came before, but they're not perfect. And in the last 5 years or so, we have started to see this technology come out. There's 2 different companies that have, allowed to say company names?
Yeah, if you want to.
I want to. So E-Gel and Salinas PRP, they're basically such a beautiful idea. The idea is, well, the problems with filler, most with the fact that the filler is not native to our body. So what if we took someone's blood and used someone's own body to make a designer biological filler we can then use for that? You draw blood like you're drawing for PRP or anything. You just draw some blood, you spit it in a centrifuge, take plasma out, and you heat it up. And when you heat it up, it forms this beautiful, almost creamy kind of gel. And you can mix it with PRP, so it's a regenerative substance, and you inject it just like you would filler. And it's native to that person's body. It came right from their body. It goes right back into their body. So there's no rejection, no allergic reactions. It's 100% natural. It came out of your body 30 minutes before. It looks absolutely beautiful. You have any amount of volume you want because the patient's manufacturing it for you. You're not getting it from a factory in Ireland. It's right there. And it looks absolutely beautiful. And because you have those natural growth factors from the patient's own blood, it regenerates the skin as well. So it's one of these, I believe, and we'll find out in 5 years if I'm right, I believe that this is the next big revolution, in the aesthetics world, where we're going to be moving away from synthetic fillers and moving to biological regenerative fillers. And I'm just so excited about that. I think that's going to be a really fun and beautiful journey to go on.
Yeah, it's actually interesting. I've talked to a lot of medical practices across the country, mostly focusing on the aesthetic side, and more of them are bringing in the regenerative medicine. Even the smaller, newer practices are starting off with regenerative medicine. And I mean, a couple of years ago, you would have never found anyone who was offering this, so especially not the new ones, maybe the more established ones who want to try new things, but now it almost seems like everyone's offering it. So I definitely think that we are going in that direction. People are looking more for, I guess, the natural look, the more holistic way of doing it, not the manufactured way of doing it.
Well, I mean, it's safer, and it gives a result that looks more natural because it is natural. If you're regenerating the patient's existing tissue, it's going to look like the patient's existing tissue, So, and we just haven't been able to technologically. I mean, biology is just so incredibly complicated. Kind of getting tissue to grow in the exact way that you want and not in the way that you don't want is very tricky. But I think that we're finally starting to crack that code, and it's an exciting time to be in the field. Absolutely.
Yeah. Now, I want to talk a little bit more about your practice itself, and I want to talk about really what differentiates your practice from others in the industry. Can you talk about some of those things that really set you apart from the others?
That's always a great question. And for me, it comes to, there's 3 things that I think set us apart from most practices. The first is, I really, really edge of medicine. And that's true for a lot of practices. Some people are they have their thing they've been doing for 10 years and they're happy there, and that's fine. There's a lot of people that want to be on the cutting edge, but in a smaller practice, it's really, really hard because if your, physician leader is in the room all the time doing procedures all the time and they're the sort of the front line, they don't have free time to be going to meetings and reading the literature and listening to lectures and figuring out what that thing is and demoing it and doing the science, bringing it on, implementing it. So I think it's very difficult for smaller practices to stay on that cutting edge, and I'm so incredibly blessed. I have an incredible team. They do everything that I hate doing so I can spend my time working on the science, which is what I really love, and getting the science into practice. And I'm very that way. So I think just the fact that we have an individual who can give dedicated full-time research to where the field is going, I think that, separates the types of things that we can offer. That's the first thing. And then the second thing is, I kind of alluded to it a little bit earlier. Most of medicine is this model of patient reaches out and says, I need something. I need Botox, I need filler, whatever it is. And you make that appointment and then you go do it. At Restore, our goal is to turn that model upside down, because the patients are not the experts in the field. We are, right? They have jobs, they have kids, they have, hobbies, they have other things that are taking their time. My job is to be the expert in the field, right? And so when a patient comes in, I believe that my responsibility to that patient is not just to give them incredible care and help them reach their aesthetic or functional goals. My job is to give them the education about sort of what's happening, why is it happening, what's the background of what's happening here, develop a care plan for them, and then help them implement that care plan. So it's not the patient calling us and saying, I want Botox. It's us reaching out to the patient and saying, hey, we got your care plan here, and our goal is to take 10 years off, and the next treatment that you need to kind of stay on that care plan is a fractional laser, or it's a round of filler, or whatever it is. So I think that our ability to organize the care and help execute a care plan for our patients, I think that's a little different than most practices do, and that's something I'm incredibly proud of. Because patients, they don't want to deal with it. They want us to tell them what they need, and they want us to be right, and those two things are important. And the third thing that sets us apart really is just the strength of our staff. We are so lucky to be. I believe we're a quite respected practice in our area, and so when people apply for a job with us, and that allows us to have practitioners that are just unbelievably, just incredibly talented, incredibly good at what they do, incredibly passionate about what they do. And then I train the hell out of them. I put them through a residency program. It takes about 1.5 years. And people talk about it like my parents' generation talked about Vietnam. They get this sort of shell shock look like, oh, I remember the training, but it's, we create experts. And once you create an expert, then the care that you can give is different. And so those are the things that I am most proud of about our practice. I think those set us apart. Yeah.
Wow. And I think also, I mentioned in your introduction, you have 3 locations. So, I mean, that's pretty incredible as well. I think it just speaks to the quality of the work that you do and just the demand for it. And you make your clients and your patients happy. So there's more demand and you can open up more.
Yeah. And we are currently scouting location number 4. My sister is actually out as we speak, driving around, looking at some different locations for number 4. So yeah, it is exciting. And I love being able to make our patients happy. And that sounds like such a cliche, but I swear to God, it's really cool to be able to make people, that's a gift to be able to do that. So I enjoy it a lot. Yeah.
Okay. So thank you for sharing that. So then you kind of touched upon one thing, was the education side of it. Like for many other practices, they're not able to keep up with the education and the learning. And this also, I think, translates over to your patients and your clients when they have questions, or maybe they're thinking that they need something when that's not the right fit for them. So what would you say is your approach, how you approach it, and also how you train your team to approach it? How do you educate your patients about the services you offer and the benefits? Yeah,
absolutely. Well, when it comes to the way that you think about problems, have you heard that there's people that are lumpers and people that are splitters, right? People that put everything together into big categories, and the problem there is oversimplification. And there's people that want everything to be its own individual category, and the problem there is too detailed, right? So I try to hit the happy medium, which everyone thinks that they're hitting. But the way that I organize the material in my head, the way that I present it to my patients, I say, we think of the aging process, we say that word and we think it's one thing, but actually I divide the aging process three separate processes. They're happening to all of us, different speeds and different people based on your genes, your environment, and your lifestyle, but there's three things. And the key to getting a beautiful and natural and sustainable result is that you use the right tool for the right problem. And almost in my head, I have this picture of like three sort of big like buckets like lined up against a wall. And every tool that we have, whether it's a laser or an injectable or whatever it is designed to treat one of those three causes. If you use the right tool for the right cause, it looks beautiful and natural, and if you don't, it looks unnatural. Our job is to help guide you. So the three pieces of the aging process are muscular aging, which is the top third of the face caused by muscle contraction, pulling at the skin every time you make an expression. And over the course of time, it breaks down the elasticity of the skin. Since it's caused by muscle contraction, it's solved by muscle relaxation. That's our neuromodulators. That bucket, there's only one tool in there. It's a neuromodulator. It works beautifully for the upper third of the face. The second piece of the aging process is skin aging. Our skin is in a barrier between us and our environment. Its job is to protect us from the environment. That's really tough. Like, we're aquatic animals, right? Living in a high altitude desert. Like, that's a very tough job for something that's like 300 microns thick. But it absorbs a lot of abuse. And because of that, it gets broken down, degraded over time. But skin is a regenerative organ. The only organ in the body, I would argue, that has the full ability to regenerate. And we take it totally for granted, right? You cut your skin and new skin grows. And you're like, you cut off your leg and grew a new leg, that would be amazing. But we just take it for granted that skin has the ability to regenerate. Mm-hmm. So with skin, the cause is just wear and tear of life. And the solution is to regenerate that skin, which we do with our lasers, microneedling, and tools like that. Mm-hmm. And then the third piece of the aging process is structural. We have all this wonderful structural tissue that sits across our mid-face and holds our face up like a scaffold. Like, we always do this, right? And it looks beautiful. And as we age and as that breaks down, it slumps down, you get hollow, fold. So any problems down here, we solve by increasing the volume. So when I'm talking to patients, I'm like, okay, is this a muscle problem? Is this a skin problem? Is this a structural problem? Is it a combination? And then we basically build them a care plan that says, okay, do you have muscular aging problems? Yes or no? Yes, here's what we're going to do. Do you have skin aging problems? Yes, what do they look like? Here's what we're going to do. Structural, same thing. And then we give a care plan and we save a copy in the chart. And then we're like, okay, 1, 2, 3, here, this is what we're going to do. We get to follow it. But it's a beautiful document.
Got it. And there must be some common misconceptions that you get all the time when people come into your practice. People that think that, oh, I want this, or I want this, or no, I want this instead, when it's really not the right fit. So what would you say are some of the common misconceptions you get most often?
Oh, by far, the most common misconception I get is where they need filler. Because the symptoms of volume loss are not the places where you actually put filler to fix the problems of volume loss. So if you think about this, right, you get hollow, fold, right? So you get hollow up here because the volume that's supposed to be sitting here filling that hollow slumps down and creates these creases and folds down here. So patients are always like, I want filler here, I want filler here. I'm like, no, you need filler here. What we need to do is we need to lift everything up and back to where it belongs, and that will lift these lines and that will fill that hollow. And that's when so people come in asking for trough filler all the time. I'm like, nope, we're doing your cheekbones instead, honey. Or people come in nasolabial fold. I'm like, no, baby, we're doing something different. Because really what we need to do is we need to lift everything up areas where the volume has migrated to, and you fill those instead. You get puffy, it looks very like almost feline, like a cat, and it doesn't look good. So I think that for patients to where the filler needs to go, I think that's very tough. And then definitely people will always come in and be like, I've got here, can you put Botox in? I'm like, no. That's a volume line. That's an area of volume loss. We need to address it with volume. But I think that filler placement is by far the least understood and least intuitive, I think, of all of them.
Got it. And as part of that, maybe not the misconception side of it, but you did mention before, as far as there's a higher level of care being in SX and being on the emergency side. So how do you balance providing that relaxing experience for your patients, but also ensuring their safety and well-being?
Making sure it's medically rigorous. Well, it's a front of the house, back of the house question. Like in the restaurant industry, because I was a waitress when I was in college, as so many of us were. And what the manager always used to tell me, he's like, restaurant, it should be like a swan. It should look beautiful and graceful and calm on the surface, and underneath the feet are doing this, right? And the same is true in the medical aesthetic spot. Like, my responsibility as a physician is to make sure that the science is rigorous, that we're doing good, solid medicine, that we're making the appropriate decisions for our patient. And on the surface, it's supposed to look just elegant and charming and spa-like. And, the key with that just comes back to the quality of your providers. Like, my providers know that if they come out of a room and they say, listen, Dr. Waples, we've got a patient here, want this procedure, they're willing to pay for it, but I don't think it's the right thing for the patient. They know that I will back them up 100% of the time. Like, if the patient wants something and wants to pay for something that's not going to give them the result they want, it's not based on their skin type or whatever it is, we don't do it. We'll stop. We act in our patient's best interest, whether they want us to or not. And sometimes people do get frustrated with that, but I think that takes precedence. If you're mixing medicine and money, one of them's got to be on top. And I think that the only way to do it ethically is for the medicine to be the one that makes, that's where the decision comes from. And you just have to stick to that. And ethics only count if it's hard to uphold, right? If it's easy, everyone does it.
Yeah.
But my providers know that, and they know I take it seriously. And that's our policy.
Well, that's a great approach and great policy. Now, my next question, I'm curious on how you would answer this, because when people think about medicine, they typically think that there's a step-by-step process, there's a procedure, there's a protocol. But what role do you believe creativity plays in how you approach patient care?
Well, that's a really good question, because I'm a scientist. And first, last, and always, I'm a scientist. And the reason why, the Statue of David is considered such an incredible masterpiece is because the proportions align the way that they are supposed to through scientific means. And we've all seen the drawings, Leonardo's drawings with the circle and the lines. There are certain proportions, beautiful body should match. So I don't believe that there is much room for creativity. I think that if you understand the science, if you truly, truly understand the science, it's not creativity to go one path or another path. It's still all science. So that may be a very boring answer, because I'm a very scientifically different person, but you understand the rules, you understand when to apply them and when maybe to bend them, but none of that's creativity. It's all science. And I think science is beautiful. Yeah, that's what I think.
Okay, that's a good answer. It's actually interesting because many other people I've interviewed, they all believe that it's like an art and a science, and there's a lot of creativity that goes into it. So actually, your answer is a little bit against the grain, which is interesting, because I want to understand kind of your perspective and how you look at it. And you coming more from as a scientist side, I think that kind of paints a little bit more of that picture, where others, maybe when they go into aesthetics, they think of themselves more as an artist, not so much as a scientist.
Well, because this is the thing, I think, and that, and again, this is one of those things that, again, maybe me being arrogant, it's entirely possible, but I believe that if you can't explain it, you don't get it. I believe that, and when it comes to science, if you can't explain what you're doing, and if you can't go through step by step and say, this is why I did it here, this is why I did this other thing over here, if you can't explain it, you don't understand it. And if you don't understand it, I don't think you should be doing it. So, creativity is a word that people use to describe a process that happens deep in their brain that has rules, that has science behind it, that has meaning behind it, but that they have not thought about consciously yet. My opinion.
No, it's a great opinion.
I believe if you have not thought it through, that's, yeah.
Got it. Now, Dr. Waples, throughout your experience, I'm sure that you've run into some particularly challenging cases. So could you talk about maybe one case that really comes to mind that was just really tough, really challenging, and how you were able to get a successful outcome out of it in the end?
Yeah, I mean, they're generally speaking, my patients are, they're lovely human beings. The work that we do is, we do a very good job, and the vast majority of our patients are happy. But there can be challenging cases, and most of the challenging cases when the patient wants something that's either not the right thing for them, or maybe they want something in a way that's not entirely healthy, and that can be a challenge. And of course, I'm sure you've heard about it. It's a psychiatric disease where usually something horrible has happened to a person, something terribly wounding has happened to them, and they are in so much pain, they can't accept that it happened to them, and they take all of that pain, all that anger, and they focus it on a physical attribute. They will say things like, if my lips were bigger, people would love me, right? I mean, that's on its face, obviously not a true statement, because plenty of people without big lips fall in love every day, but they start to believe it, because if they believe that the problem is this other physical thing, then they don't have to face that pain, right? They can become this external thing. And so body dysmorphia is a problem. I had a nice lady, very, very nice lady, educated lady, who came into me and she said, well, I want my more projected. I want projected in my jawline. I said, okay, that's fine. And so I did a syringe of filler in her chin and sort of gave her a little bit more projection. She did have kind of a smaller, kind of regressed chin, didn't have much of a jawline. I was like, okay, that's fine. And then a couple weeks later, she comes back, but still an argument could be made, like, we can put a little bit more in there. Like, okay, so I did another syringe. And she came back a few weeks later and she was like, well, I need you to put more in my chin. And I was like, well, now we're starting to get a little bit out of balance. And she, basically breaks into tears and tells me that her husband is going to divorce her. And the reason he's divorcing her is because her chin is too small. And if I won't put more filler in her chin, then I'm responsible for her divorce and she's going to sue me, and just starts escalating and escalating. And it was sad. It was so sad. And I just kind of sat there and I was like, listen, I'm so sorry. Like I can't do this. I can't help you. This is not a problem that we can solve with filler. And she was absolutely devastated and sort of stormed out. Those patients, you can't fix the problem by continuing to apply band-aids to it. And with those types of patients, I think you just have to, at some point, you just have to call and say, listen, we're using the wrong tool here. Like this is not a problem that's fixed with filler. This is a problem that you got to talk to somebody about. And folks don't want to hear that very much sometimes. But yeah, I think those are the toughest ones because they're not doing it intentionally. It's not mean. They're really in pain, but we can't fix it with filler, so you got to go.
Yeah, I think you brought up a very good point that not a lot of people think about because you're the doctor, you're the professional, and it comes a point where you have to tell them this is what they need to do or stop doing based on your knowledge and your experience, and even for their own safety. But unfortunately, sometimes they don't want to listen. Or that she's going to try and go somewhere else and get it done, and someone who is just looking at it from the money side, it's be like, okay, we can keep doing more, but kind of like we mentioned before, the ethics side, it's not easy, especially in situations like this.
It's sad. Those are sad cases. I feel for those patients. I did, but we can't help them by putting filler in.
Yeah, no, but I want to switch tracks a little bit. Hopefully, something a little bit happier on this one. But we mentioned in the introduction you have the Restore Academy, so I'd like to touch on that. Like, could you tell me a little bit more about Restore Academy, what you do, like who it helps, things like that?
The fact that and I think this is true everywhere, not just in Colorado, but finding qualified people is really, really hard, right? Because the field of aesthetics is very new. And so there's no, there's, especially for mid-levels, there's no accredited training program where if someone says, hey, I graduated from this place and here's my degree and I'm ready to go inject, Botox, and you can just send them into a room. There's nothing like that. You pretty much, when people come to you, you almost always have to train them from scratch, or at least plug holes. The people that were coming to me, I kept having, nurses and NPs and PAs apply to my practice who had taken these one-day training courses, where it's like Botox and filler, and it's one day, and they do 3 hours of one, 3 hours of another. They get these little certificates, And I felt really bad for them because I was like, that it's not their fault. That is pitifully inadequate training. Like you need much more than that to actually be able to do these procedures in a safe and appropriate way, unsupervised in a room by yourself, and it's not their fault. Like the places that are selling those kinds of training certificates are, they know it's not good enough. They know that no one can actually get a job with that, but they're selling it to these kids who don't know any different. And they would come in with their certificates. And I'm like, honey, that I got to be honest, that does not actually qualify you to do anything. So it bothered me. It bothered me to see that. So I started Restore Academy, basically offering the same training that I give to my own people when I'm training somebody from scratch in my practice. The same level of training that I give to my own people, basically offering it to people outside of our practice. And it's absolutely wonderful. It's a great tool. Everyone who's ever taken our class is like, that was the most amazing thing, because it's offering instruction of a level which is a little bit higher than most people can access. And so we're very proud of that. And then secondly, it's also this wonderful recruiting tool, because when people come in, they take a class with us, they also, it's a chance for them to audition. And we will take the best people from each class, and we'll let them be an intern with us, and we'll potentially hire them. Right now, I think 100% of my clinicians came through Restore Academy, because we get to pick the people with the best hands, the best knowledge, the best patient, interactions. And so it's become both an amazing recruiting tool, amazing retention tool, and also it helps us maybe raise the level of the caliber of injections in the area generally. And it's really fun in those ways. I like that. I like teaching. It's a fun thing to be able to do. Yeah.
Okay. Well, thank you for sharing that. Now, when it comes to going back to aesthetics, where do you think the future of aesthetics is going?
Regenerative medicine, full stop. I think that, we have always been trying to make people look younger and healthier. Right. And we can't change their chronological age, but biological age is something that we are starting to be able to change now. Right. And so how much better is it to actually make someone's body biologically young and biologically more healthy and biologically more beautiful, as opposed to trying to make it look like it, Like, I feel like, in the older days, we kind of were trying to do this thing where we're trying to drape, pretty skin on a sick body, and that was the best we could do. But now we can actually rebuild the body. We can rebuild the skin. We can make it so it's all, natural, your tissue, your body is actually becoming younger and more healthy. And that's just a cool thing. That's a cool time to be in aesthetics. So I think neuromodulators are going to stay the same. I don't think there's anything that's going to change in that science. I think that I think that lasers are on their way out. I think 10 years from now, it's going to be exosomes and growth factors. Instead of doing a wound to create remodeling, we just create remodeling. We skip the wound. No pain, no downtime. You just go straight to the remodeling step. So sort of skin booster revolution, that's where that's going. And I think we already touched on filler. I think that 10 years from now, HA fillers there'll still be a place for them, but it will be a minority of what we use to replace volume. Most of what we use will be autologous and natural. And I think that'll be a great step forward for our patients. I think they will get better results with less risk, and the science is just fascinating, so I'll enjoy it. But I think that's where we're going.
Okay. Now, I have one last question for you, but before I ask it, I want to point people to your website at www.restoremedicalspa.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Absolutely. You need to go to a place, and again, it's difficult. Let me say this instead. It is difficult for a layperson to gauge the medical knowledge of somebody that they're talking to. And so we use these stand-ins. We use, well, if the place looks really, really nice or has very slick marketing or whatever, that person is probably successful enough. So they probably know what they're doing. As far as how you could choose, I mean, I'm a medical professional. I go in, I ask them questions. If they don't know the answer, I don't trust them, and that's hard for a layperson to approximate. So I would say, my own opinion, I would say you want to make sure you're going to a place that has an MD as a medical director, MD or DO as a medical director. You want that person to be on site. You don't want that to be some kind of fly-by-night person that no one's ever seen. You want that to be a person who's involved in the training and the day-to-day operations, being there. And if you do those two things, you go to an established place that's got good medical direction and good supervision, you're probably going to do beautifully. And I think that's probably my best advice, because I just start quizzing people. That works for me.
Okay. Well, thank you for sharing, and thank you for being here on the show. So, Dr. Waples, where can people contact you and your practice?
Yeah, I mean, the best way, if anyone wants to get in touch with us, is go to our website, like you said, www.restoremedicalspa.com. No E, just RESTOR, because we're very hip people. There's a contact us button, and you can reach out to us. We do, of course, consults for all of our patients. We love to answer questions. We're excited about what we do, and we would just love to have anyone talk to us about just about anything. So that's the best way to reach out to us.
Great. Well, again, thanks for being on the show and sharing your message.
All right. Well, thank you so much for having me. I appreciate it. Have a wonderful day.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.